Welcome to WUNews, your trusted source for global health awareness, medical education, and real-world public health information. In today's video, we are going to discuss an important but often forgotten sexually transmitted infection known as Chancroid, a disease caused by the bacterium Haemophilus ducreyi. Although Chancroid is less common today in many developed countries, it remains a serious public health concern in several regions of the world, particularly in low- and middle-income countries. This video is designed to provide accurate, detailed, and easy-to-understand information about Chancroid, including its history, causes, transmission, symptoms, prevention, treatment, global spread, and long-term complications. Whether you are a student, healthcare worker, researcher, or someone simply seeking reliable information, this video will help you understand Chancroid clearly and responsibly. Before we begin, please remember to subscribe to the WUNews YouTube channel, like this video, and share it with others. Your support helps us continue spreading life-saving knowledge to people around the world. What is Chancroid? Chancroid is a bacterial sexually transmitted infection, STI, caused by Haemophilus ducreyi, a fastidious gram-negative bacterium. The disease is characterized by painful genital ulcers and may be accompanied by swollen, tender lymph nodes in the groin, known as inguinal lymphadenitis. Unlike some other STIs that may be silent or asymptomatic, Chancroid usually presents with painful symptoms, making it clinically distinct from conditions such as syphilis, which typically causes painless sores. Historical background of Chancroid. Chancroid has been recognized as a distinct disease for centuries. Historical medical texts from the 18th and 19th centuries describe genital ulcers that were clearly different from syphilitic chancres. The term Chancroid itself means small chancre, distinguishing it from the larger, painless chancre of syphilis. In 1889, the bacterium Haemophilus ducreyi was identified as the causative agent. Before the widespread availability of antibiotics, Chancroid was extremely common, especially in port cities, military camps, and areas with high rates of commercial sex. During the late 20th century, Chancroid played a significant role in the global HIV epidemic, as genital ulcers greatly increased the risk of HIV transmission. Although rates declined in many countries with improved STI control programs, Chancroid remains endemic in certain regions. The bacterium, Haemophilus ducreyi. Haemophilus ducreyi is a gram-negative bacterium, difficult to culture in standard laboratories, highly adapted to infecting human skin and mucosal tissue. The bacterium enters the body through microscopic breaks in the skin during sexual contact. Once inside, it produces toxins and inflammatory reactions that lead to tissue destruction and ulcer formation. How Chancroid is transmitted. Chancroid is primarily transmitted through sexual contact, including vaginal intercourse, anal intercourse, oral genital contact, rare but possible. Transmission occurs when the bacterium enters through tiny cuts, abrasions, or micro tears in the skin or mucous membranes. Key risk factors: unprotected sexual activity, multiple sexual partners, sex work or contact with sex workers, poor genital hygiene, presence of other STIs. Chancroid is not spread through casual contact, such as hugging, sharing food, or using the same toilet. Incubation period. The incubation period for Chancroid is usually 3 to 10 days, but it can sometimes extend up to 2 weeks. Symptoms typically appear faster than many other STIs. Signs and symptoms of Chancroid. 1. Genital ulcers. Begin as small red bumps, quickly progress into painful open sores. Ulcers have ragged edges and a soft base, often bleed easily when touched. 2. Pain. Unlike syphilis, Chancroid ulcers are painful, which often prompts individuals to seek medical attention. 3. Swollen lymph nodes. Occur in about 50% of cases. Painful swelling in the groin. May develop into pus-filled abscesses, buboes. Can rupture and drain spontaneously. 4. Differences between men and women. Men usually have visible ulcers on the penis. Women may have internal ulcers, leading to delayed diagnosis. Complications of untreated Chancroid. If left untreated, Chancroid can cause permanent scarring of genital tissue, chronic pain, secondary bacterial infections, increased risk of HIV transmission, psychological distress, and sexual dysfunction. Global distribution of Chancroid. Chancroid is now rare in most developed countries, but remains present in parts of sub-Saharan Africa, South and Southeast Asia, the Caribbean, some regions of Latin America. Countries with limited access to healthcare, STI screening, and antibiotics are more likely to report cases. Diagnosis of Chancroid. Diagnosing Chancroid can be challenging due to laboratory limitations. Diagnostic methods. Clinical examination of ulcers. Laboratory culture, rarely available. PCR testing, advanced settings. Diagnosis by exclusion, ruling out syphilis and herpes. Healthcare providers often treat based on clinical suspicion in endemic areas. Treatment of Chancroid.
Chancroid is curable with antibiotics. Common treatments: azithromycin, single dose; ceftriaxone, single injection; ciprofloxacin, multiple doses; erythromycin, 7 days. Prompt treatment leads to rapid healing and prevents complications. Prevention of chancroid. 1. Safe sexual practices. Use condoms consistently. Reduce number of sexual partners. 2. Early testing. Regular STI screening. Immediate medical care for genital sores. 3. Partner notification. Inform sexual partners. Encourage testing and treatment. 4. Public health education. Awareness campaigns. Community outreach. Chancroid and HIV connection. Genital ulcers increase the risk of HIV transmission by up to 10 times. Treating chancroid is a critical part of HIV prevention strategies. Living with and recovering from chancroid. With proper treatment, ulcers heal with 1 to 2 weeks. Pain reduces quickly. Long-term complications are rare. However, reinfection is possible without preventative measures. Important myths and facts. Myth: chancroid is extinct. Fact: it still exists in many countries. Myth: only sex workers get chancroid. Fact: anyone can be infected through unprotected sex. Why awareness matters. Many STIs, including chancroid, remain underdiagnosed due to stigma and lack of information. Education saves lives and prevents the spread of infection. Subscribe. Call to action. If you found this video informative, please subscribe to the WUNews YouTube channel right now. Like, share, and comment to help us spread health awareness globally. Turn on notifications so you never miss an important update. Thank you for watching WUNews, where knowledge protects lives.